Dr. Martin has practiced for nearly 20 years in a small Midwest community. Miss Nathan, a recovering alcoholic and a divorced mother of 2 children, has worked in his office as a dental assistant for the past year and a half. It has been 2 years since Miss Nathan has come to terms with her chemical dependency and received treatment. Through a program advocating employment for the rehabilitated chemically dependent, Dr. Martin hired Miss Nathan. She is grateful for his work opportunity, has earned Dr. Martin's trust and confidence in her, and has received 2 salary increases. Dr. Martin has indicated a future possibility for her to become head assistant. During the past 4 months, Miss Nathan has observed Dr. Martin during the day routinely taking pills that she recognized as prescription tranquilizers. He also began frequently calling in at the last minute to break appointments, to which he arrived looking disheveled and appearing shaky. On several occasions, she had detected alcohol on his breath after long lunch hours, during which the patient was kept waiting. He suffered from noticeable mood swings. All these signs indicated to her that Dr. Martin was probably struggling with chemical dependency. Out of her personal concern and his welfare, and knowing the hell of being in this diseased state, but being unable to acknowledge it or overcome it alone, she decided to speak to him confidential. 2 months ago, after work, Dr. Martin was seen completing patient charts. Miss Nathan took advantage of the moment. She approached the matter sincerely and openly described what she had observed. She stressed that she did not wish to interfere in his life, but that he was special to her because he had given her a fresh start, that she was concerned that his afflictions would affect his practice and his health. She asked him to seek assistance and offered to put him in contact with a help group that would treat the matter confidentially. Dr. Martin reassured her he had no problem and that he was just going through a difficult adjustment time. He was, in fact, going through a messy divorce, and in the midst of this, a child custody battle. Furthermore, he confided in her a pending IRS investigation, which increases his feelings of stress. He thanked her for her obvious caring and promised not to come into the office in that condition again. But less than a week later, the following week, Dr. Martin returned from his lunch break with glossy eyes and an odor of alcohol. His patient was already seated and waiting. As Dr. Martin proceeded into the operatory, Miss Nathan felt there was nothing she could do but follow him into the room and assist. When Dr. Martin completed a routine crown preparation, Miss Nathan was relieved that no mistakes had occurred from his noticeable tremors. That afternoon, she again called Dr. Martin aside and implored him to seek help. She pointed out that his character work, he was noticeably shaky, and that even the patient had asked her if he was all right. She noticed how embarrassed she felt having to cover for him. He snapped back that it was just a bad day, that everyone has bad days, and that she was overreacting. He suggested that her own past experience may be making her a little oversensitive to the non-existing drinking problem, and further reminded her that he, in fact, had given her a break and that he needed her utmost support as he worked through his outside troubles, and that her loyalty during these trying times would pay her dividends to her and her family. 4 months have now passed, and Ms. Nathan notes that Dr. Martin's lunch break highs are continuing and his clinical performance seems increasingly hindered. Although she has not yet detected any resulting injury to a patient, she feels that it is time to do something. What are her options? So, in this scenario, this case study, we have some options that Ms. Nathan could do. The first thing that Ms. Nathan could do is to show the same compassion and empathy that was given to her by Dr. Martin in her time of hardships. She can approach the matter in a more serious tone and plead with Dr. Martin about seeking help for his addictions. She can also let Dr. Martin know that she herself can also support him in accompanying him to any of these sessions for drug and alcohol abuse, and together she can help him continue to have a fresh start, and he can be able to keep his practice, children, avoid future injury to his patients, and avoid any malpractice lawsuits, or avoid the suspension or revocation of his license. Ms. Nathan can also draw the line and report him to the dental board. In doing so, this will be putting him at a greater risk of losing his practice, revoked license, legal cases, and the loss of respect of the community. After many attempts to try to help Dr. Martin, if she does not take proper action, she as well can also be reported to the board for not reporting impaired behavior, which is breaking the code of ethics and core values: justice, veracity, non-maleficent. Or what we can do is Ms. Nathan can continue to document and record impaired behavior, stand up for what is her moral obligation to report any behavior that could compromise the patient's safety and the integrity of her duty as a dental assistant. So, what would you do?